Thank you, everyone, for joining us today on Purely Positive. My name is LJ Thomas, and I am your host. This week's Purely Positive person is he's the founder of the Global Child Health and Safety Initiative in Lagos, Nigeria. I'll let him tell you about all that stuff. Welcome, Charles. How are you doing today?
I'm great. Thank you for having me.
Oh, you are very, very, very welcome. Okay. We have a lot to discuss because you do a lot. Your organization does a lot. First of all, help me understand what the Global Child Health and Safety Initiative is.
Okay, well, essentially, the vision of Global Child Health is a safe, healthy, and just world where every child can grow and thrive to their maximum potential. And we envisage a world that's free of disease for the children and also free of child sexual abuse. That's essentially that's our vision and that's our goal.
Okay. Now, I know that you work with, excuse me, my allergies are really acting up today.
Sorry about that.
Yeah, me too. But I know you work with a lot of partner organizations and you have a lot of partners. Tell me about the educational initiative that you have going on.
Okay, essentially, we realize that education is the major source of bringing people out of poverty, disease, lack, sickness. So we have gone into collaborative efforts with certain other developmental partners to offer education grants to indigent girls in Nigeria, in the poorest of the poor. So that's our hope, to empower these women, because we are big on gender equality.
Okay.
And it's my personal belief that an empowered woman equals an empowered family, which equals an empowered society. So, and education remains the greatest tool for empowering people to help them realize their greatest potential and to live it up. So that's why we have this program that we do to help indigent girls get an education.
Great. I love that. I'm big on education too. Now, I follow you on Instagram, clearly, and you are very welcome. I'm always amazed at how detailed your posts are. For instance, you working with over 3,000 teachers. Do I have that right?
Yes, exactly.
Okay. What is it that you're doing with those teachers in relationship to more than helping the indigent girls and so forth? What kinds of things is the organization doing?
Okay, we have an offshoot program that's focused on children's mental health. And one of the ways that we realize that children run into depression and negative emotion is through child abuse, whether it's physical, verbal, sexual, emotional, or neglect. So what we did is, in order to entrench global best practices in childcare, we decided, let's reach out to childcare professionals in Nigeria and train them and just organize capacity building workshops, seminars, and conferences that will empower these groups of professionals and help them get more thorough in their work with children. So essentially, we realized that due to the economic situation in Nigeria, children are spending more time in school than at home. And so teachers are beginning to assume a greater childcare role than just the intellectual duties they had in the past. So that being the case, these children are spending more time in school. We thought we needed to equip the teachers on greater skills on how to be better childcare professionals. So that's why we run the training for teachers, and our trainings with them focuses on child sexual abuse, verbal abuse, emotional abuse, and neglect, so that they can spot the earliest signs of abuse in children. And then we also empower them with practical steps to take to prevent sexual abuse in children especially. So that's what we do.
Okay, so I'm just making sure that I got this, because that was a tremendous amount of information. So basically what you're saying is that because children are in school more, you want to equip the teachers with all the skills that they need to be able to recognize when something is wrong with a child, whether it be any kind of abuse, and to be able to not only recognize it, but also empower them to be able to help the children so
Exactly.
that they can grow and learn, well, not so much learn, but grow and maintain mental health, because these things are the foundation for a lot of mental health issues.
Exactly.
Okay.
Exactly. That's it. Because we've done a lot of work with at-risk youth here in Nigeria, and we
Okay.
realize that most of the problems that young people face and
Mhm.
go with them up into adulthood is
Mhm.
traced back to childhood. So we
Right.
decided, let's do something about childhood. That's the foundation of every human being's life. So
Right.
we're just going to contribute our best to see that as many children as possible have a firm, healthy, grounded foundation.
Okay.
That's which is like a determinant for having a mentally balanced young adult and adult life.
You are so right. Things do go back to childhood, and people think,
Oh
oh,
yeah.
well, you're a child, you'll grow up and get over it. No, not necessarily.
No,
You hold
that's the
on
truth.
to it.
Because the inner child never grows.
Exactly.
Mhm.
Exactly. That is very commendable. I was checking out your Instagram before we started the interview, and I've been liking things along and along and along. But
Oh.
I noticed that there are several posts related to getting sleep. Tell me
Mm.
about that.
Oh yeah, well, that's just well, not just in Nigeria, but world over. There's like a great wave of depression and suicide that
Mm-hmm.
seems to be the norm. Like lots of people are under pressure. It could be financial pressure, it could be pressure of relationship, whatever. And if not properly managed, it could lead to depression and
Right.
ultimately suicide. Now, I hold strongly to the belief that suicide should not be the great wake up call to depression. But
Right.
sadly, it is.
Mm-hmm.
Okay, lots of people have problems, people around us are battling issues, and no one pays attention. Okay, until something goes wrong horribly and the person just, takes their own life, and everyone is awakened to the fact that, oh, this person had a problem. But we're saying, no, what can we do now to prevent suicide and to help people who battle depression. And so, in collaboration with one of my mentors,
Mm-hmm.
Mr. Lanre Olushola, he's a life coach in Nigeria. He's the foremost mental health specialist in Nigeria. So,
Oh,
he came up with a program and we decided to partner with him and help disseminate all that information about steps that people can take if you know you're having issues with depression, you're feeling sad, you're feeling moody for extended periods of time. These are signs of depression. Don't
right.
wait for it to sink deeper. Now, what are the steps that you can take? You actually caught me. I just woke up from sleep because there's so much pressure. There's so much work pressure. And if you don't take time for yourself to relax and recuperate, you might just be run over with so much. So that's the whole essence of those, bits and pieces of information that we have on our Instagram, just to help people eat better, exercise more, take walks,
Mm-hmm.
rest, get friends who really care about you that you
Right.
can share, your problems and your worries with, those types of things that will just make you healthier and rediscover the zest for life.
Wow. Nice. Very nice. Now, I
Yeah.
know that you're in Lagos,
Yes,
but
I am.
I also know that you don't just focus on your local area, your local
Yeah.
city, or
Yeah.
you're national, basically.
Yeah.
You work with the
Exactly.
whole of Nigeria. How
Yeah.
far outside of that does your scope, does the work that you do encompass?
Okay, essentially, all we do, we're actually global, okay, but we decided let's start from where we are. Let's start from
Mm-hmm.
Africa. So when I came back to Nigeria, we put out operations. We started in Lagos because everyone knows Lagos is like it's a micro Nigeria. As a matter
Right.
of fact, Lagos is a micro Africa. It's just a complete picture of what you get anywhere in Africa. And we do have a saying in Nigeria. if you can survive in Lagos, you can survive anywhere on the earth. So that tells you how dynamic, how
Okay.
beautiful, and yet how challenging Lagos is. So we set out our operations in Lagos. We had lots of interventions, advocacy, and all of that. And then we began to get calls from outside Lagos saying, oh, we need this, we need this. And that's how we just decided to move. So we
Oh,
moved from state to state. We have about 6 geopolitical zones in Nigeria. And as at now, we've covered 3. We've had like massive interventions in 3 of the 6 geopolitical zones. So we're still looking out to cover the whole country and possibly spread to the Western African coast because the message we have is one that everyone needs to know. So
you
we're
are,
just going, hopefully, with some sponsorship and funding, we'll be able to do more.
you are so right. The when I saw the name Global, you know, Child Health and Safety, that was very intriguing to me because, you know, most people choose one or the other, you know, it's,
Mm,
but that is, while it seems like a broad term, it's something that is very necessary. It's very needed.
mm,
Like you said, around the world, it's just when we start with the children, if you
mm.
start with the kids, then you can make a better society across the board,
Exactly. Yeah. Yeah.
you know. And most people don't think about it that way,
Mm.
but save the kids. Save the
Exactly.
kids. If you
Yeah.
want to have a future,
Safety.
save the kids.
Exactly.
You know, I also know that you all have workbooks, you have
Hmm.
financial education, you do the safety of children, you do the
Yeah.
health of children, you do
Mm.
so many things. How do you find time to get everything done?
Okay, great. I have an awesome team. First of all, we have a board of advisors who help,
Mm-hmm.
directors tell us, just give us the best advice that anyone can have. I have an awesome, a wonderful team of women on that board. And funnily, I just find that I work better with women, because women are so consensuous. They give more and expect nothing in return. I'm really big on gender equality. I tell people I'm a male feminist. So, now, apart from our board of trustees, I have an executive team. I don't do everything alone. We have about 6 members of the executive team, and I happen to be the only man on that executive team. So it's all back to the wonderful women in my life, and I have a team of about 4 full-time staff that work with me, and it's just one other man. And then we have a large team of volunteers, about 120 volunteers that help
Wow.
out with all these. So we have them grouped in different departments, and they handle different projects. Like the project on health, we have a health team.
Mm-hmm.
That on the safety of children, we have a child safety team. We have,
Mm-hmm.
like you mentioned, it's a new project that we're developing, the financial intelligence for Teachers
Mm-hmm.
Hub, because we realize in this part of the world, teachers are really poorly paid.
Oh.
And we get to tell them how they must improve their childcare duties and all of that. But we found out lots of them are under intense financial pressure. And when someone has those kinds of pressure in their life, you really can't expect that they'll give their best to their jobs. So
Right.
we said to ourselves, what can we do to help this biting pressure that will reduce, such negative impact on the teacher and free them up, let them have more positive energy to
Mm-hmm.
put to their work with the children. And then we set up a team, to come up with the financial intelligence for Teachers Hub. And essentially the aim of that is to, equip them with, skill set to become
Mm-hmm.
more financially responsible, learn how to manage, whatever accrues to them. And then we're also going into some collaborative efforts with some people in agriculture because in Nigeria there's a big move towards agriculture. So we
Yay.
want to, open up some of these teachers to investment opportunities in agriculture. They don't have to be, actively involved in
Mm-hmm.
agriculture. They can just invest and over a cycle, okay, recoup their investment and some profit. So
Okay.
that would just to augment their income and make them more financially stable. So that's
Wow.
exactly what that's about.
So you tackle the whole problem because not only
Oh
are
yeah.
you helping the children, but you're helping the teachers to be able to
As
help the
well.
children. I love that whole
Exactly.
concept.
Exactly. We want to do it's a holistic approach so
Right.
that one does not suffer at the expense of another.
Hmm. See, that's how you build strong societies when you have all avenues, being uh, included in anything that is going to benefit everybody. That's
Exactly.
you know that's amazing. I'm so
Thank
glad I talked
you.
to you. I'm so glad.
Oh, thank you so much.
I'm so glad you
Thank you.
have. What is the next big thing or the next thing that you all are looking to do?
There is a lot. There is
A
so
lot.
much that we're looking to do. But essentially, at the very nearest future, we're hoping to go into collaboration with another organization in the area of illegal migration. Because that's a major problem in Nigeria. Okay, because the situation in Nigeria is not really the best that it can be, but
Right.
we're hoping and working towards it, be improving. So this has necessitated lots of young people and even older people to embark on dangerous illegal migration to European countries and
Mm-hmm.
even the United States. So we're trying to we're going into collaboration. I just spoke with members of the team
Mm-hmm.
yesterday, and we're looking at how we can come together and try to help the Nigerian youth understand the implication of illegal migration on the life of the adult and on the life of
The
the children.
child. Mm-hmm.
Yeah, because we discovered lots of, some young mothers leave the children in order to go to embark on illegal migration. And some of them end up as sex workers, slaves, and
Right.
all of that. So that's the next thing that we're looking at, collaborating with while we still continue our child advocacy studies training. That's for the teachers and child care professionals
Mm-hmm.
in order for early detection and prevention of child sexual abuse. So
Okay.
that's essentially where we are at.
Wow. There's so much that you guys are doing. It's amazing. I like to
Mhm.
see, um, no matter where the organization is based, I love to see these kinds of things happening because we can't always depend on the government to do it.
Oh, sure, we can.
So,
And we can. It's never happened.
so,
Development comes from the people.
right. So we do what we can in order
Mm,
to help each other. And in helping
mhm.
each other, we end up helping ourselves. And that's
Oh,
what
yeah,
it's all about,
exactly.
to make the world a better place. Now, as
Yeah.
I've mentioned, I follow you on Instagram. But if
We're
someone
so
wanted
proud.
if someone wanted to get involved with helping you guys do things or just to contact you for any type reason, what would be the best way to contact you?
Okay, well, we have our social media platforms. That's
Mm-hmm.
Instagram at Global Child Health. That's one word. And we're
Mm-hmm.
also on Facebook at Global Child Health and Safety Initiative. And then we have our phone numbers. That's 234 So these are all avenues that we can be reached.
Okay. Okay, good. So now I have to ask,
Mhm.
if you were to say, what is your biggest need right now?
Whew, it's a no-brainer. Funding.
Yes.
That's
Yes.
the biggest need that we have because we have the people, we have the
Mm-hmm.
programs, we have everything designed. Now, I must tell you, we have a program design backlog that will take us for the next 2 years
Oh.
of impact. Yes, we do. We have all that printed, we have them in files. We know what to do, and we are
Mm-hmm.
fully equipped to do these things that has to be done to improve human life. But sadly, the major determinant in the power you have
Mm-hmm.
to implement some of the projects that you have is funds, and we
Always.
lack funds big
Always.
time. That's the major, major, major issue. So if we can
Always.
get, partnerships, sponsorship, funding, that would be brilliant. It would just help us coast. And the thing with Nigeria is a very little, change you bring to
Mm-hmm.
the system leads to really huge impact. That's
Ah.
the thing. Nigerians are very industrious. Nigerians are hardworking. Nigerians are happy people. We want to make the best of our situation. That's the thing with Nigeria. So when you're empowered to make just a small change in
Mm-hmm.
the lives of people, it's such a roller coaster effect, and it goes a
Gotcha.
very long way. So just with a little fun, we can do so much. That's just it.
I got you. I'm fortunate to have interviewed a previous guest there in Lagos, Nigeria, and he
Oh,
he actually has an education initiative teaching tackling the illiteracy rate there, and I
oh,
was so impressed with
mm,
how he's doing everything, and so that my talking with him actually prompted me to look at the country and to see what other things were
wow.
going on, and that's how I found you guys. um
Oh, awesome.
and so we've been talking back and forth for a good while now, actually probably about going on 7 or 8 months, trying to get an interview together with our
Oh,
schedules and
wow.
stuff. Yeah, and so finally I am so glad that we were finally able to get this done.
Yeah, thank you.
You're welcome. What would you say to our viewers out there? What is the thing that you want them to know more than anything?
Well, it has to be the need for everyone to pay close attention to every child around you,
Mm-hmm.
whether it's your biological child or not. Every child is your child. For every moment you have, every privilege you have to spend with a child, that child is yours. So you have to give your best to ensure the health and the safety of that child. I just want everyone all over the world to understand that without children, we have no future. Without children, the human race would go extinct. And this is the most sensitive period in the life of a human being. And we must do everything we can to ensure that it's a balanced phase. Education is important. Health is important. The safety of a child is important. Protection of children is important. So we have to, it's a combined effort. Everyone must come together and work together to ensure the safety and the health and the well-being of every child in the world.
Very well said. Very well said. With that being the case, we're going to leave you with that positive thought. Remember that positivity is a choice. Being positive is your personal choice. Thank you all so much for joining us today on Purely Positive. I'll see you next time, and I'll be talking with you soon.